if those would, okay, I see Adam, so that's great. Dawn, Ernest, Jorge, good to have you. Looks like we got Manish. So Colin, thank you. Andrew, Anthony. We still have some folks that are coming in here, but let's go ahead and get started because there's a lot of ground we want to try to cover today and get through to you as much information today as possible. Again, my name's Eric Auger. I'm the Director of Research and Development here at American Business Systems. So again, I certainly want to welcome you here to this afternoon's webinar. First of all, I want to take a few minutes and address who is American Business Systems and what we've been able to do for the past nearly 20 years here. And what we've been able to do is take folks that are looking to get into the medical billing business as a business opportunity, and folks just like yourself. You know, it's just folks that want to have their own home business and work from home and just need the correct tools in order to be able to do this type of billing and this type of business. And speaking of tools, we do have one of the top billing platforms and EMR systems out there that is out in America right now. There's no doubt. It is a web-based platform. It certainly helps you actually get more clients because of what it can do and how it can actually help collect more money for the doctors. So we'll be talking a little bit more about that because that's really one of the reasons why we would say that doctors would want to outsource their billing to you. If you haven't already, for those that are brand new on a webinar, maybe the first time you've seen American Business Systems, we want to make sure that you've gone out to our website, American Business Systems. It's absystems.com. First of all, you can go there. You can see that there's so many links here, tell you a little bit about iClaim and EMRX. But what you want to do is hit those orange buttons there, which will get you into what's called our virtual brochure. And this is what we're looking at right now. And folks, this is where you're going to want to find more information. If you really wanted to be a student about this business, this is the best place to get started. Look about the opportunity, what that entails, and getting clients and the training, and so many of your questions can certainly get answered there. So you're going to want to utilize this depository of all of this information that you can go through. American Business Systems has been and is still a part of one of the nation's largest group of independent medical billing companies, which is HBMA, the Healthcare Billing and Management Association. And then also a lot of people ask us about our rating with the Better Business Bureau. And as you can see here, you can go check us out. ABS has the highest rating possible with the Fort Worth BBB, so go check us out there. And really, if you want to really know more about us, after you've done a lot of your due diligence online, come by and visit us. We're here at 5751 Kroger Drive in Keller, Texas. Keller, Texas is a little community north of Fort Worth, so please come by and join us and visit with us. We'd be happy to visit with you and show you the system and show you all the things about the business in and of itself. We just got through with our first training class for 2013. And we are fast approaching on our next one that's coming up. Our next live training workshop is going to be February the 25th through March the 1st. So if you're planning on learning about this business, getting into this business, certainly you probably already know about our live training workshop and what all of that entails. So we certainly want you to get signed up there. So give us a call here and check us out and check us about those specific dates. Those classes do fill up pretty quickly. So you're going to want to, if you're looking at trying to get into this business, please give us a call. Now let me introduce you to our founder, Patrick Phillips. Patrick is a well-known author. He's written a few books here, as you can see here. One, How to Program Yourself for Success. Another one he's co-authored here called Wake Up, Live the Life You Love. And then finally, this Cash Crunch to Cash Flow book. We'll talk a little bit about that book because this is how you will be able to use in your marketing campaign of getting out for your doctors. So really, without any further ado, let me bring Patrick on here. Patrick, it's good to have you here this afternoon, and let's get talking about why doctors would use any of the ABS medical billing companies.
Oh, man, there's so many reasons, Eric. I'm going to be moving through this data fairly quickly today, so folks, tune up your brain to receive in fast forward mode, okay? Because there's a lot to cover here. And you know what, Eric? I thought I would start with a study that was done by the selfgrowth.com website on in-house versus outsourced billing. Now, there's a lot of data here that I'm just going to skip over. So if you guys want a summary of this from your ABS rep, just ask them and we can get this to you. But basically, they asked the question, is outsourcing medical billing services more viable than in-house practices? Because let's face it, most doctors are either doing it in-house or they've already decided to, outsource their billing. And so how is it that our licensees are signing doctors up on a regular basis? Well, here's one of the reasons why, because in-house, there is the inability of the internal staff to adequately devote to the requisite medical demand. In other words, they're spending time messing with all that paperwork, Eric, instead of, back in the back seeing the patients.
Right.
That is a big problem.
Yeah, and I'm glad you're bringing this up because, I think, and Patrick, you know as well as we know on the research and development side, we really do know that doctors, they do know the value of outsourcing versus in-house billing. It's just that they've got a couple of little issues that they have to work through, and we here at American Business Systems, we know how to address those issues.
Yeah, you were just talking to me a while ago just about a couple of those things. One of the things, of course, is this right here, limited adaptability. When they're doing billing in-house, there's lots of stuff going on, lots of changes, keeping their staff up to date with all that's going on. They can't keep up with all that. And so as a result, their medical claim retrieval rates, in other words, the money that they get paid, goes way down.
Right, absolutely. And so, and you've got this one here about employee turnover factor. I mean, this is huge. I mean, just as soon as a doctor gets someone up and running on their billing, all of a sudden they end up leaving.
Yeah, I mean, an employee can find another job, for $1 an hour more, and they are gone, and the doctor just left. Well, we have licensees all the time tell us that that's why they signed up a doctor. They just ran into a doctor that said, "Hey, my biller just quit. What do I do now?" And then, of course, all the money that doctors have to spend on the technology. Imagine what they've got to spend, Eric, to get not just the billing software in their office, but all the networked computers. They have to keep up with all the updates to the software. And it's just a very expensive overhead that they've got there trying to do it themselves.
Yeah, it's tremendous, absolutely.
And with the little slim margins that doctors are working on, it doesn't take much to, put a doctor out of practice. And then, of course, outsourcing has a lot of advantages. Now we switch here to outsourcing. Here's one of the advantages is superior expertise and resources. Guys, outsourced medical billing services come with, a tag of superior expertise and resources. And the single most objective of improving clients' reimbursement rate is usually because they have the tools, techniques, and technologies and knowledge to get that done. That's what you are focused on as a medical biller, right? You're not just focused on a million different things going on in the doctor's office. And then, of course, there's greater control over the operating costs. You guys, as a medical biller, of course, have certain costs, of course, but you are doing the billing for several doctors. So you have that operational efficiency that's built into the economies of doing it for, a number of different doctors. Each doctor having to pay their own costs, that's where it gets very expensive. Then there's the seamless claim realization. Because of the competency of you doing this through a web-based system like we have, especially, that makes it very seamless to get those payments made to the doctor. And it's all because it's an integrated system. We have one, as we'll show you in a minute, that involves not only the medical billing system itself and the electronic health records system, but it also has the clearinghouse built right into the system as well. And then one of the last things here is directing the internal staff to the core activities. In other words, being able to redirect the staff in the doctor's office so that they can help the doctor see more patients is the real big reason why it's very, very efficient to outsource the billing. And, of course, the doctor's got that risk aversion as well because outsourcing it, he doesn't have to worry about all the HIPAA rules and regulations, the competition, the technology changes that are coming up and so forth. They can just focus on what they do best, which hopefully is to get doctors' patients well. And the last thing for outsourcing is to improve the core business focus. Again, because they're free of the shackles of having to do the billing, the physicians are able to devote their time and resources to the core concern of keeping the practice benchmark in congruence with the prevailing best practices and just doing what it takes to run an efficient practice. So,
Well, Patrick, I mean that is and I think doctors understand that. And right before we got on the webinar today, and we kind of addressed that between you and I right before we got going here. Doctors really do understand that, and hopefully even a little bit today we can talk about it, and even have a further webinar a little bit later on, talking about what are the biggest obstacles. Why would doctors not want to outsource? And we can eliminate those as the way that the system works. We can eliminate their biggest obstacles.
Yeah, and I think what you said earlier, Eric, is true, that doctors basically, they want to focus on their practice, and yet they're kind of scared of, they don't have the transparency with most billing companies. And so ours is a little bit different, folks. We have a complete solution that includes, like I said, not only a web-based billing system that you can give the doctor access to be able to see the reports and the status of their claims, but we have that electronic medical record system that's built into ours, so the doctor doesn't have to worry about going back and forth and wondering if the data that he puts in on his end when he's seeing a patient in the EMR is actually going into the billing system to make sure that the patient gets billed for that. It's all integrated. And then we're pretty unique, Eric. I don't know of any other company, do you, that actually has the clearinghouse function all built into the same system like we do?
No, and Patrick, it's amazing that even if they do have a good clearinghouse, and one is an MDON, that if a doctor is using that or an outsourcing billing company is using that, it takes anywhere from 24 hours to 48 hours to get just the information back to whether a claim is good enough to send to the payers.
Yeah, and then if it's rejected, that whole process starts all over again. And then the last piece of our puzzle to our solution, I should say your solution, folks, if you get involved with American Business System, is that it's you. It's the people that are behind the whole system. Remember, it's not just a billing system. It's having somebody that's been trained to know how to solve that revenue cycle. So in addition to the iClaim and EMRX systems that we have and the clearinghouse that's all built in and approved by the ENAC organization, you have your people that are trained. You come down to Dallas, we train you for a full week and teach you exactly what you need to know to solve those cash flow problems that the doctors are facing. All right, so I just kind of wanted to give you a feel for why the doctors would want to outsource billing to you specifically. It's because of our complete solution. But let's get down to the nitty-gritty. We've got about 15 reasons why the doctors will definitely want to outsource their billing to you. One is the billing is not a doctor's core competency. We kind of touched on this a while ago because we know that it's the seeing of the patients and the helping the patients get well that the doctors want to focus on. For you as a medical biller, you have the ability to focus on the thing that helps the doctor get paid, which is the submission of the insurance claims through our web-based system. And that allows all doctors out there, folks, to really, really focus in on their core competency and do what they love to do best. I mean, they weren't trained to do medical billing in college. They were trained to, help patients get well.
Hey, Patrick.
Yeah.
There's a question that came in, and we do want to encourage people to type in their question.
Oh, yeah, absolutely.
So this is a good time to ask this because, we're dealing with, the doctor's core competency. Mm-hmm. The question came in from George. It says, why would a doctor give out the business to whom someone doesn't have any references or experience in the field in the first place?
Well, that's the great thing about being associated with American Business Systems, George. We are the nation's largest network of independent medical billing companies. So when you go out and open your office in your city, you're not just opening, George's billing service. By the way, we'll teach you to name your business better than that. But you're not just a little independent person. You are a part of a nationwide network of over 1,500 offices. Folks, we do thousands of claims every day for hundreds of doctors from coast to coast. And so you position yourself the correct way, and we are the credibility that you need in the marketplace, as you'll see as we go through some of the reasons why doctors will be outsourcing to you. Yeah, great question. Well, here's reason number 2 that they'll outsource, because they're seeing more patients and they need their staff to help them in seeing and processing the patients that are out there. Look at this quote from the Galen Institute. The healthcare legislation, this is before it was instituted, of course, it says, will provide more people with access to care, but the challenge is getting enough primary care doctors to meet the patient demand. Folks, can you imagine what happens when we've got what's the number, Eric, for uninsured Americans? 35 million or something like that.
35 million, 40 million, absolutely.
Yeah. You put all those in the waiting room, folks, and the doctors are going to have a real problem, especially because, as this quote says, there will be a shortage of 150,000 doctors in the next 15 years. Now, folks, that's from the Association of American Medical Colleges that graduate these doctors. Eric, I have a feeling that a lot of that has to do with the fact that doctors don't like what they see in the whole change in the healthcare system, and the fact that they're not making near the money that they used to make as doctors. You used to think of doctors as making, I don't know, at least I saw figures back in the early 90s of $400,000, $500,000 a year. Now, a doctor who's a general practitioner is lucky to make $150,000.
Right. Yeah.
All right, reason number 3, doctors have trouble collecting money from their patients and insurance companies. Well, that's a given. That's why they need you. Folks, doctors sit around figuring out, why is it that my cash flow is not what it needs to be? Well, it's because the staff, even though they're probably doing as best as they know how, are not trained and do not have the system. It goes back to the system that can keep those claims going through and getting paid. And that's a key to success in collecting money from the insurance companies, having the right system. Ran across a book out there that's on your screen right now, folks, called Prepare to be a Millionaire. Now, this is 43 millionaires in 7 different industries, and this is one of them, Dan Newman. Look what he says here in this book. For the next 10 years, the medical industry is going to be the most wide open field. Every doctor, dentist, hospital, and clinic has trouble collecting money from the patients and insurance companies. I believe that over the next decade, so much money will be made in this particular industry that it will blow you away. That's saying quite a mouthful there, isn't it?
That is absolutely. I mean, this field, for anybody looking to get into a good, strong business opportunity in anything, do it in the medical field, but more in the area of actually for collections.
Yeah, that's right. Getting the money that the patients are not paying. We have services, folks, that you can offer to doctors to help with that side of the cash flow as well. Look, here's a quote that shocked me when I first saw it from the McKinsey.com website. It says, physicians typically collect only about 50% of the outstanding patient balances. Think about that, Eric. What other business do you know that only collects half of the money that's billed to their customers? And yet, doctors.
Patrick, those I think we've actually seen percentages even higher than that.
Yeah. Some of our doctors, 60-70% of their money is never collected.
Never collected.
And of course, we have a service called Choice Pay that helps with that. It collects that money and reduces the patient bad debt, gets the money faster from those patients, and reduces the cost on the doctor's end for collecting that money. The patients are satisfied and happy with it. It's very secure, HIPAA compliant, and all that. And it's an online patient payment portal that allows the patients to go in and make their payments. So it encourages the patients to do that themselves rather than us having to continue billing them each month. Okay, and then look at this. Typical medical offices have an average, they call it a DSO, days sales outstanding, of 52 days. And more than 20% of their AR balance is 120 days out. Eric, that's 4 months before they see their money.
Well, that could be 120 days out and still nobody even working that to even try to collect that. So a lot of that gets lost.
Yeah, that's why some of our licensees have walked in and found drawers full of accounts receivables up to $500,000 just sitting there. So with our Choice Pay Center portal, this allows those patients, again, to go in and make those payments themselves, which, of course, solves a lot of problems for the doctor. All right, reason number 4 that they'll be outsourcing to you, folks, is because they waste a lot of money doing the billing in-house. Yeah, imagine what it costs to just maintain this small doctor's office right here. One doctor, let's say, one assistant, a PA assistant, and maybe a couple of people up front and a nurse. This is huge overhead. In fact, this quote from the New England Journal of Medicine says that market analysts estimate that 24 cents out of every dollar in an office is wasted on the administrative and billing expenses. And we've even broken that down here in a chart. Eric, you kind of want to talk about this chart?
Yeah, absolutely. And here we're looking at annual costs for physician billing versus outsourcing. And if we just take, just a standard 400 claims here times 12 months, and we see here at $100 at 6%, that's given you as a billing company $28,000. That's what the doctor would be paying to get those services done. For those same services, having an employee, one and a half, we like to say one and a half because there's always one person and somebody else helping out there, at $15 an hour, just the labor cost alone is $46,000. And plus, then you start putting in the payroll taxes and the workman's comp insurance and errors, omissions, training, if there's any leave coverage. Totals can be totaled up to $65,000. Someone was asking me, Patrick, the other day, do we have a cost comparison if someone is having employees versus outsourcing? And here it is. This is it. $65,000 or $28,000. That in and of itself will increase the doctor's pay.
Yeah, I mean, $36,000 savings on the doctor's part by outsourcing his billing, that's kind of a no-brainer. I mean, if you're a business person, you look at that and go, hey, that's a down payment on a nice car.
Right.
Or a nice vacation, for the doctor, or a new piece of equipment in the office. So it's nothing to sneeze at. And there are other studies that have been done that have said it costs a doctor up to $57.46 per claim after you figure in all the time and money that's spent dealing with an insurance claim. Well, that's more than most doctors' claims. Yeah, I know.
Exactly, because some claims are only like $65. $60.
Right. So he's lost money almost on that claim.
Yep.
All right, so let's move to number 5. Doctors who need a larger patient base and do not know how to market their practice. Folks, doctors are not taught how to build their practice. If they're a fairly new doctor especially, there's always a turnover. There's always what do they call it? A rate
attrition
of people.
Rate. Yeah.
Thank you, attrition. Right, that's the word. People die, people move, and so forth. And doctors' offices have huge overheads. Look at this fancy office here. You don't want to see just 1 or 2 people sitting in an office like that at any one time because that's a huge overhead. So we've actually got a system that teaches you to teach the doctor how to build their practice. Yeah, it's an online postcard and greeting card system. Now, these are not e-cards that are sent by email. These are physical cards printed out in full color with messages on the inside from the doctor. You can even add their signature to look like they signed the card, and it looks like it's coming from them. This is a great way to remind the patients that the doctor's here always to be able to solve their cash flow. So you can be a part of that and make a lot of money helping the doctor make money too. All right. I know I'm going through these fast, folks, but again, remember, that's why you need to get back with your ABS rep and ask them more details about any one of these things. I just want to get your thought process going today. All right, so claims processed in-house do not get submitted in a timely manner. And this is a shocker here. Look at this. This is from an insurance plan company that says 29% of the claims were received from the healthcare provider more than 30 days after they saw the patient. Now, Eric, how is that possible? That it sits around in an office for 30 days, before it gets submitted?
Well, it could be because they're trying to get patients to go see the doctor, or, they're checking in insurance eligibility. There could be a myriad of things why the claims don't get submitted.
Yeah, they stack up, and of course that's cash flow. A doctor has to have cash flow just like a business does. Look, 15% of those were 60 days. All right, so number 7 is that large numbers of claims are rejected due to staff errors or outdated software. Yeah, in fact, this study said that a single physician practice can expect an average of 69 rejected claims per month. And Eric, explain why. What are some of the things that can cause an insurance claim to be rejected?
Well, one of the things is wrong information in a system concerning the patient's demographics, which would be their name and address. That could be one of the simplest things rectified, especially with our system. It could be the wrong dates of service. It could be just little bitty nitbacky things that could cause claims to be rejected. But again, with our system, it kind of eliminates that area of a lot of these claims being rejected.
Yeah, in fact, this quote here from the American Academy of Professional Coders says that the average number of rejected claims for medical practice is around 34%. Now, Eric, what have you heard from our licensees as far as our system? What kind of rejection rate are they getting?
Oh, we have consistently less than 2% rejection rate.
Yeah, folks, 2%. Did you hear that? Less than 2%. We can show that to you. The system actually keeps up with that percentage for you, and you can actually see that inside the system what the rejection rate is. The doctors are astounded when we bring their rejection rate down from this 34% to the 2%. And look, here's an actual case study that one of our licensees provided to us. This was a doctor that was doing about 7,200 claims a year at about $125 face value. So they had a rejection rate, Eric, get this, not 34%, but 60% rejection rate. So
that's astounding.
Yeah. So we increased their revenue, this licensee did, by 41%, or translated into dollars, $500,000 a year. You think that licensee wasn't a hero? Actually, it was a lady, so a heroine, is that the word?
Heroine.
Heroine. Yeah. So, folks, when you can do that for a doctor, why would you even ask the question, why would a doctor outsource to you? Because we can show you and give you this kind of data. No other company that I know of can provide you this kind of documentation and proof that it can save a doctor a ton of money. All right. Reason number 8 is that doctors and their staff do not have the time to resubmit those rejected claims. So with that 34% rejected claims, they don't ever get back, some of them never get back to them and resubmit them. In fact, the American Academy of Professional Coders again says 25 to 40% of rejected claims are never resubmitted for payment. Eric, that's just
that's amazing.
That's money just left on the table, isn't it?
Absolutely, and it drives the doctors just completely bonkers. Why they can't get their claims taken care of?
I found a doctor who said he was going bonkers because of that. There's a picture of him right there. Okay, Eric, I'm not.
Doctors look like.
Yeah. Hey, I'm not even paying attention to the questions there. So if you see something in the question box, folks, there's a question box on the right-hand side there in that control panel somewhere on your screen, and just type your questions in there. We'll see them. We read them out loud as they come in and answer them live. This is live.
Absolutely. Absolutely.
All right, doctors.
All right.
Oh, sorry.
No. I was gonna help you out there about the number of doctors lose, rightful income due to undercoding their visits.
Now, what does that mean?
Undercoding?
Yeah. What's this coding all about?
Yeah. Okay. Well, not to be in so much fear about people having to, you as a medical billing company have to code, but that's the doctor's responsibility. And when we mean by undercoding, we mean by doctors don't want to submit their own super bills like this with these codes that would put them in jeopardy of being audited. And so what they do, they undercode, they put lesser values on their when they go when they're seeing a patient. So this is a tremendous issue that is very common with doctors, because you know what, Patrick, doctors don't want to be audited by Medicare or anything, so they're like, well, look, I'm just going to code with a lesser value, so it doesn't generate any red flags there.
Yeah, that's right. And what you're looking at, folks, here is these are procedures, for example, and these are codes over here that the doctor has circled. This is a piece of data that you actually get from the doctor electronically through our online document management system. And the codes the doctor has put on his super bill, they all have created their own super bill like this for their most common codes. And they're there for the doctor to circle. He saw this patient, for example, at a level 4. That depends on how much time and what the doctor did when they saw a patient. Well, it could have been that this could have been coded at a level 5, which could mean another $40 or $50 for the doctor because he did spend that time. But they'll undercode because they're scared, like Eric said, of being audited by Medicare. They can come in and fine the doctor, what is it there, $10,000 per.
It could be up to.
Yes, yeah.
Absolutely.
And as you can see from this quote, the average physician could increase their monthly billing by about 30% if their medical coding was done accurately. Well, folks, we have a service that you'll be able to offer to the doctor that's provided by our certified medical coders. So even though you don't have to know anything about the codes, our certified coders can review the doctor's codes and make sure that they are what the doctor needs to be submitting. And if they do, on average, they can increase the doctor's revenue by up to 30%. They do that by reviewing the doctor's codes and providing printed reports like you see here to the doctor. They go over these with the doctor to let the doctor know, here's where we think that you could be, increasing your revenue and still be very safe as a doctor submitting those claims. So it's a great service. It means money in the doctor's pocket, and of course the doctors love it. And so you of course make money on all these services, even though you're not doing the actual coding review. All right, number 10. Doctors spend a lot of money on staff training and benefits. And I have another way of looking at this, folks. This is just similar to what you just saw right earlier. But as you can see, this is another example, a real-life example of what happens when a doctor takes in consideration all that they spend on employees versus outsourcing to you. Now, folks, you'll notice that in this example, we're using a 7% figure. We've had licensees charge, anywhere from 5, 6, 7, 8%, sometimes 9%. Depends on the doctor, the volume of claims, the amount of the claim, and the type of specialty and so forth. But we'll help you with all that pricing. So this is just an example, but it's a great example of how another doctor here saved $17,000 just by outsourcing it and getting that billing outside their office. When they do, they're much, much happier. This is why doctors will refer other doctors to you. And Eric, isn't that how most of our licensees will tell us that's how they grow their business once they get that first doctor?
Yeah, absolutely. I mean, word of mouth is the best way. There's no doubt about that. That's always been the best way to market.
Yeah, we teach you how to find that first doctor, and as you'll see, those doctors will refer other doctors to you if you do a good job for them. Now, here's reason number 11 why doctors would love to outsource their billing to you, because outdated software constantly needs updating. Excuse me, Eric, you know that in the earlier years, American Business Systems actually sold, the software that's on the right there, Metasoft. There's other software that's out there that's available that comes on a CD, it installs on your computer, and it sits in your office. Tell us why that's probably not a good idea.
Wow. I mean, in today's world with the technology the way it is, number one, just the increased expenses of having to maintain servers and the possibility of just the legal side of everything with all the patient data out there. I'm telling you, that and plus with that, as soon as new codes come into play or updates that need to happen in the system, somebody's always having to maintain all of that information. And so not with our system. Ours is in the cloud, as they would say, or on the internet, on the web, and this is the way things are going. There's no doubt.
Yeah, cloud computing is what everybody's going to. Google, Yahoo, Microsoft. Everybody recognizes that by using the internet and just letting people log in from any internet browser directly into a site, they can actually do anything from anywhere 24/7. And in fact, ours is so high-tech, you can actually do it on the latest tablets and iPads, and yes, even smartphones. The doctor can be having access to his schedule, for example, as you see here, right from his phone, even while he's out on the golf course.
Absolutely.
So the doctors love it, folks, when they realize that this is all HIPAA compliant. It's got redundant servers. The data is out there very safe and secure, backed up nightly. This is much safer than having the computers in his office containing his patient data, because like Eric said, the computer could be stolen, the hard disk could crash, there could be a fire, all kinds of reasons. And believe me, nobody in a doctor's office takes time to back up the data, like they should every night.
Well, one other thing about that too, Patrick, that's one of those biggest obstacles that doctors are concerned with about outsourcing is what about the transparency? And this gives that doctor that level of comfort of transparency. Yes. This is exactly what we're talking about.
Yeah, because he can even on his iPhone or iPad go right in and see the status of all of his money at any time, 24/7. He could be on a cruise and log in on the ship in their computer room and actually see the status of his claim. So it's very transparent. It doesn't get any better than this. All right, reason number 12 is that Medicare can audit the doctors for overcoding and fine them thousands of dollars. Now, we talked about earlier about undercoding, the doctors undercoding, but this is another service called Audit Guard that protects the doctor against those audits that we said from the Medicare and identifies all the charting errors that they might be having. Remember, when you first go into a doctor's office, you don't know what's been going on there, right? So this is a great service to offer the doctor to review everything that's been done and improve everything in the doctor's office and protect them from overcharging their patients and maybe charging a level 5 visit, for example, when it really should have been a level 4 or 3. So it comes with, of course, all kinds of reports as well done by our certified medical coders. Nothing that you have to do, folks. This is provided by us, but you, of course, are offering it to the doctor and making money by just offering the service to the doctors. All right, reason number 13 why they'll outsource to you. Doctors are confused about the new healthcare legislation. Wow, that's an understatement, isn't it?
Yeah, no kidding.
And how to qualify for the stimulus money available from the government for implementation of electronic health records. Eric, talk to us about that stimulus money.
Yeah, let's go to that next slide there. I mean, the doctors can recoup, or not really recoup, but gain $39,000 in their implementation of electronic medical records. And it all has to meet certain requirements that are called meaningful use. And a lot of people that do get in the business with us and have a little bit of familiarization about electronic medical records usually ask us, does our system meet the requirements for meaningful use? And it does, and that gives you the availability to go out there and gain new clients just on that alone. So not only can you help the doctors get on a very solid electronic medical records platform, but also help them get that money called for their $39,000 from the government just by implementing an EMR system.
Yeah, so this is kind of like a little, I don't know what you'd call it, but it's certainly an incentive for the doctor to get up to speed on electronic medical records. The government knows it's going to cost the doctor something in time, and a lot of EMR systems that are out there, Eric, are very expensive, aren't they? $50,000, $60,000, $80,000.
Yes, and then even more than that to maintain at times.
Right, and from what we've heard, only about 6% of all the medical providers are using an EMR that meets all the guidelines for medical meaningful use. So, folks, that means that it's a wide open market. You can build this thing as big as you want to. When you see our electronic medical record system, which we have branded EMRX, you'll see that this is a system that's designed to be used by the doctor when they have a patient encounter in front of the patient. The doctor can use their iPad or tablet computer to access the system directly, and everything's going directly into it, again, just using their Wi-Fi connection in their office. It's just, when you first see this, it's like, wow. You hear a lot of wows, don't you, Eric, when you do the demonstrations?
Yes, we do. I mean, and that's part of one of the support mechanisms that you as a licensee will get is the access for us to help you present this to the doctors. So absolutely. Yeah.
Okay, and reason number 4 why doctors would want to outsource to you folks is because they're drowning in paperwork. You've seen the stacks and rows and cabinets behind the doctor's office, their staff, and in fact some of them have boxes down the hallways and flowing over into other rooms. This is a huge problem for doctors. And folks, you can solve this problem as well. Because like this quote here from Secretary Kathleen Sebelius of the Department of Health and Human Services, she says, now that the government and stakeholders are coming together, we're finally poised to make a huge transformation in healthcare and leave the days of illegible notes, misplaced folders, and musty file cabinets behind for good. How do we do that? Well, we do what we call a virtual file cabinet. This is out in the cloud, and it's another service that you'll be able to offer to the doctors called iDocs Now. It's secure storage of all those records online through a web-based system, folks. That means it's available to the doctor from any computer that has internet access using any browser at any time. They can search the documents. they can print them, they can email them, they can do everything they would normally do. How do they get there? Very simple. They scan those into a simple little scanner, and that goes out there into the cloud, and when they look at the system, the iDocs Now system, they actually can pull that document up on the screen, annotate it, mark it up any way they want to, forward it to somebody else, print it out. It's just a wonderful way to keep everything online and available to all their staff, because all their staff can have, access and logins to the system as well. This is the future, folks. Doctors are tired of dealing with the paper. They just don't know how to get out of it, and we have the system that you'll be able to offer to the doctors to get them out of that mired down stack of paperwork. All right, last point I want to make today is this, folks. The doctors want technology that will help them spend less time on the administrative and billing. Now, here's what we mean by that. Eric just mentioned this, and Eric, why don't you explain just a little bit further what you meant by this is one of the ways we help them to get clients?
Absolutely. Patrick, we both know that we want to help our licensees gain as quickly as possible and get clients on board for themselves. And so one of the things that we have developed and have been developing over some time is actually doing live demos for your prospective clients. And so a lot of people ask, and George certainly asked earlier on, why would a doctor want to use us or give us any business if we don't have really any experience in the field? And this is where we're able to help you bridge that gap. We can help close that gap pretty quickly because we have been in the business for a long time, and we know what it's going to take and to explain this to the doctors, answer their questions, and help you as a brand new licensee gain the trust factor really with the doctor too. So we want you to utilize this part of support in building your business.
Yeah, in fact, folks, if you want to visualize this, basically this next slide will show you what's happening is that we're showing the iClaim EMRX system over the internet using technology similar to what you're using right now called GoToMeeting. In other words, we can connect with the doctor. They're sitting at their computer in their office. You and your spouse, if you're involved in this together, are looking at your computer while our technology people on our end are actually showing the system. This makes it so simple for the doctor to understand how we're going to increase their billing. We show them all the different reasons why our system is going to get more revenue into their office, and we're there to answer all the questions. That's important because when you're new in any business, isn't it nice to know that we'll be there to answer the doctor's questions? And Eric, the last thing the doctor usually asks is just, what do I do now? How do I get started? Right?
And Patrick, I want to certainly say this, lest anybody think that we're just trying to sell a piece of software to the doctor, and we don't. We really do bridge the part about using technology and utilizing you as a medical billing company to increase the doctor's revenue, and that's what it's all about. So exactly, the doctors are usually saying, "Okay, what do I need to do next? How do I get there? What are the next steps?" And that's where we turn that back over to the licensee.
Yeah, because folks, we do give access to the doctor. You can give access to the doctor as a medical biller and let them see just certain parts of the system. It's a very secure, HIPAA-compliant system, of course, as this slide here is showing. And folks, it's so high-tech that it is, like it says here, compatible with all kinds of PC and Mac browsers. It's optimized for the iPad and tablet PC compatible. And so doctors can access it anywhere, however they want to. But the neat thing is that they'll be able to see reports, like that pie chart you see in this screenshot, of their data, their actual claims, anytime they want to. This gives them that transparency and that sense of control that they lose with most medical billers that are out there. It also connects to all the major labs that are out there, so the doctors can view and order lab results from any web-connected device. The doctor, as I mentioned earlier, can schedule anytime, anywhere, and see their schedule anytime they want to. And they can also see the eligibility status. Eric, you kind of like this feature, right? The system goes out and actually connects with the insurance company's database and finds out if a patient is even eligible for a.
That's correct. Well, that's one of the parts of revenue cycle management that gets left behind, and the system automatically does that for the doctors. Absolutely.
So when the doctors see all this in that demo, folks, we'll show them, for example, the drawing tool, how they can actually draw right there with their finger on the iPad and attach that drawing to the patient's record. They are just blown away. It's got the latest in e-prescriptions. The doctor can issue a prescription for any drug to any drugstore that's up on, e-prescription systems, and that's most of them nowadays. And that's ready for the patient as soon as they walk out of the office. They can also do all their interviews. There's over 2,000 preloaded interviews to assist the staff in capturing all the patient complaints and review the systems. And they can chart the vital signs for the patient and keep up with that, all electronically, all cloud-based, over the web, available to the doctor anytime he wants to see it on any web-enabled device. He can monitor the progress easily for pediatric patients and keep up with their growth charts. And get this, folks, he can even dictate right into his notes on this system using the little microphone that's there on the iPad. It's just, when you first see this, it's like you think you're watching Star Trek, don't you, Eric?
Well, I'd say what's more important is what you're about to show next, which is the virtual office visit. That's what's pretty incredible.
Oh man, this is the future. The patient can get online in what's called our patient portal and have access to set up an appointment with the doctor virtually. That's right. They don't even have to go to the office. And yes, the doctor can bill for these visits. It's all been approved by Medicare already. So if the doctor has some off hours, he wants to see patients, this is a way to increase revenue as well. Guys, when you see this system and realize that this is the latest in technology, the doctors are blown away. They see it on the demos. We demonstrate all of this during those demonstrations that we just talked about. And when the doctors see this, they absolutely fall in love with it. I mentioned the reports earlier. There's a couple of them I'm just throwing up on the screen there. Okay, so Eric, boy, that kind of wraps it up, doesn't it? Pretty fast to go through all, but I want to take some time here for discussion too.
Yeah, let's do that, because we've got just about looks like about another 10 minutes or so. So let's get to this. Let me see what kind of some questions. Now, Dawn's asking a question here that's pretty important, and it's certainly a good question. She goes, how do you protect yourself as an independent medical billing company from physicians that are joining hospitals, which is a trend in her area, which would be the D.C. area? How do we protect how does one protect themselves from that?
Well, Eric, we've had licensees just recently sign up large groups. Folks, this system is so impressive to doctors when they see this demonstration that we just told you about. They are blown away by it, and even large groups. One licensee in California just signed up a group of 24 doctors. Another one up in Pennsylvania signed up a group of over 100 doctors. So don't think too small now, folks. Even though doctors are joining other groups and even getting involved in hospitals, some of those doctors are independent. Yeah, the hospital doesn't do the billing for those doctors. They independently bill on their own. There are doctors called hospitalists, for example. Eric, you're familiar with that term, of course.
Correct. Yeah, absolutely.
And those doctors just visit patients in the hospital. So they're in the hospital all day, but they have to do their own billing. And we have licensees who have specialized in those doctors. So you've got to think outside the box.
Right, and a lot of the reasons that doctors are turning to going to some of those places is because they just can't handle the billing, or they think that an EMR system is too expensive. So there are just many different reasons why doctors feel like they got to go join a hospital or a hospital group, and you can help protect them from actually going into basically was becoming an employee of a hospital.
Well, and we see that happening all the time, that doctors who have joined a group are getting out of the group and getting back into private practice because their income dropped drastically. They lose control. They're just an employee, and they don't like that.
Right, and this kind of goes along with the question that Edith was asking about. Many doctors in her area are now connected with hospitals. who handle their billing. And so she's asking, should I write these doctors off as potential clients? And hopefully you see the answer to that would be no, because there are a lot of doctors that have left group practices or become employees of a hospital. They can leave just as much as they got into it. They can leave, and they would prefer to be independent. So no, don't write those people off.
Yeah, that was another question similar to that by Edith. She says, many doctors in my area are now connected with hospitals who handle their billing. Should I write these doctors off as potential clients? Edith, there are doctors out there who are a part of the hospital that you can do the billing for. So don't let anybody deceive you in saying, well, because doctors are joining hospitals, that you can't do the billing for them. So we can tell you more about that. Just ask your ABS rep, and we'll go into a little more detail about that.
Yeah, absolutely. Colin's asking a question, do large insurance providers have cloud-based systems that doctors and staff already use?
Yes, of course. There are insurance providers that have systems already set up, but the doctors are not. Listen, if a doctor wanted to use a system tied directly to an insurance company, first of all, not many of them actually have systems that will allow the doctor to bill them directly. But if they did, and let's say the doctor has 24 different insurance companies, imagine trying to keep up with that and submit claims to 24 different insurance companies and keep up with all the claims that are out there and the rejections and so forth. That would be a nightmare. You wouldn't want to do that. That's why there are such things called clearinghouses that we mentioned earlier that's built into our system. Most medical billers have to go out and find their own clearinghouse, negotiate all the paperwork between the doctors and the clearinghouse with that clearinghouse, and deal with the pricing and so forth on an individual basis. Our licensees don't have to do that.
Here's a question from Sonia asking, is the licensee responsible for showing the software to the doctors?
No, again, Sonia, that's something that we offer to our licensees. We have an online registration system that you can register the doctor, giving us a couple of days and times that the doctor might be available for that demo, and we set that up and send you a link to a go-to meeting similar to this one that you're watching today, and then we connect directly with the doctor's computer at that time, agreed upon time, and you're on there as well, of course, watching the demo and listening to everything that's being said. And again, we're doing the demo for the doctor. You don't have to do that. You don't have to learn the system.
Absolutely.
You're not a software salesperson.
Absolutely. Don't want to get into that mix there. Here's another one from George, and we'll just get this question going here. Is the licensee obligated to use ABS software, or does he or she have the freedom to implement a different software in his or her company?
George, the ABS licensees are totally independent business owners. And so even though we think our system is the best that's out there, again, that's totally up to you as an ABS licensee. You might find some other system somewhere down the line that you want to go with, and we're fine with that. Now, will you find another company that will do the demos for you to help you get clients? The answer is no. There is no other company out there that we know of that actually do those demos for you as a medical biller. They might do a demo to you to try to sell you on the system, but they don't do the demos for you for your prospective clients. Very important that you think that very carefully through.
Hey, Pastor, let's talk about the training workshop and talk to us. I mean, we just ended one last week, and we've got one coming up in another 6 weeks here. Talk with us a little bit about what's covered in these training workshops.
Well, that's a great question, Eric, and I just happen to have a slide that shows you some of the topics that we actually covered during that live training workshop. Now, folks, this is a 5-day workshop, Monday through Friday. It is packed. I mean, every day. We just decided today that we're going to extend the hours, Eric, to 5:30 every day. We were going to 5, but we've got so much to cover. We're actually extending hours now, and I might even push it up to 7:30 in the morning. But the point is, it is an all-day affair, and every one of the things that you see listed here, folks, we go into in detail. I mean, every single subject is covered in detail, and you'll see that we cover, like you can see here on the screen, about a half a dozen different ways that we've learned that actually work for helping you to get clients. So the marketing is a great part of this, but we bring in computers and let you have hands-on as well. Now, after the training workshop, though, we have continuing educational webinars. We did one just Friday before last, didn't we, Eric? And then we've got another one coming up this Friday. So about 3 times a month on average, we're doing educational webinars for our licensees. And folks, that's all included in that one-time licensee fee that you pay to get involved with American Business Systems. Now, if you don't know much about what's included in our system, go to our website and you'll see a link up at the top about how much is invested and what's included. You'll be able to go through all that. But these ongoing webinars are priceless, folks. I don't know of any other company that once you've signed up with them, at no charge to you, you can attend as many of these webinars and send all of your staff and sales reps to these webinars as much as you want to. So this is ongoing education that's priceless, folks, absolutely priceless. And then I saw the...
Yeah, I was going to say, you saw the question about the guarantee, so go ahead.
Yeah, let's see. It was Richard here. He says, can you guarantee that every licensee will get clients? Richard, no. I'm being honest with you. If we guaranteed you that you could get a client, why wouldn't we just get all the clients and sell you this license for $100,000? Because one doctor could make you, $25,000 to $35,000 a year for years and years to come. That would be very, very expensive. So what we do instead is we put this guarantee to each one of our licensees. As you come through the live training workshop, you will be able to see every aspect of this business, including all of our proprietary information about how you can get clients. And if at the end of the week, for any reason, you don't think this business is for you or you won't be able to get a client, then just tell us. We'll arrange for you to receive a full refund. Every penny of your license fee is given back to you. I don't know of any other company that does that. Do you, Eric? In any field?
No.
That lets you come to their training class for a week and then get your money back.
Yeah, most companies, franchises, once you pay, there's really no guarantee of anything. At least we extend that out through the training. And again, folks, we want to kind of wrap things up here and remind you that those training dates are coming up. February the 25th, which is the last 4 days of February, and the first day of March. So you've got the rest of here January and getting through February there a little bit that you want to start working your way to get to this training workshop, because the next one after that is not until April. So folks, if you're looking to get things started, you want to try to get things kicked off here the first quarter of this year, this next training would be your most best bet to get things kicked off here for the first part of 2013.
Yeah, and Eric, I think that one is about 25% full.
Already, because we had some people that couldn't make the January training that kind of rolled over to the February training, so that's
right.
Correct. So,
folks, these classrooms are small. That's because we want them to be small so we can give you the attention that we want to give to you, and so you can ask all the questions you need to ask. So they're limited to 20 people, basically. That's the maximum that we'll put in a class. I think we squeezed in one class a couple of people in there last minute. We didn't realize they were coming, but anyway, the point is, guys, it's a very small class, and it's already about 25% full. So this one will fill up. I can assure you this will be a full class. So if you're still doing your due diligence, still wondering if this is the right thing, just continue to come to our webinars here on Wednesdays. As long as you want to, you can attend these. These are free, and we try to give valuable information about the medical billing business on each one of these. And you can attend these as long as you want to until you have done the due diligence that you need to feel comfortable in investing.